And that message is that history teaches us if we're willing to learn. History informs the present and gives us a much better, more refined sense of what's really going on in the present because we know the past. So I'm going to present a very, very brief, century-long history, just touching some high points. Obviously, I can't do more in the 5 minutes that I have. But I will draw from it 3 basic lessons or take-home messages. The first, you can have the first slide, please, is that this is, as you can see, the Progressive Party Convention in Chicago in 1912. But the important thing is this group of people represent the beginning of a century-long struggle to achieve single-payer health care in the United States. And there was a tremendous bolt of energy that came from this convention. A tremendous amount of momentum followed and built over the next several years. By 1915, various organizations led by the American Association for Labor Legislation had drafted a model piece of legislation that was being introduced state by state into the various state legislatures, it being an earlier time before the notion of a federal responsibility in the area had really crystallized. That came later with the New Deal. So it was a state by state campaign. America was almost persuaded in the title of a book about this period by a famous American historian of medicine. Almost persuaded, but not quite. Because what we see very early on is the building of major oppositional forces. The American Medical Association back then, conservative politicians, right-wing organizations using lethal, awful hate tactics, and a growing commercial insurance industry. These forces mobilized using smear tactics, dirty tricks, obfuscation, manipulation of fear and anxiety, and sloganeering with now familiar trigger words. Next slide, please. This was the kind of propaganda produced by an earlier political Sarah on the right, said to be a labor leader, sort of, I guess, like Joe the plumber, who was opposed to labor's attitudes. Look at all the trigger words here. Compulsory state health insurance. It's in German. It's foreign. Known in German as Reichskrankenversicherung. And you know we don't want that. It's socialistic. Socialistic leaders endorse this, and so on. You can follow down, and you will notice at the bottom that this is produced by something called the New York League for Americanism. There are 2 street addresses, one in Syracuse and one in Buffalo. An enterprising historian has tracked down those addresses. Guess what they were? They were commercial insurance companies. In short, this was a right-wing front organization doing the work of the commercial insurance industry and injecting into the American political battle these kinds of slogans. The sad news is, these kinds of slogans work very effectively, and we still, to this day, have to guard against them. So my second message, the first is very long-standing, my second message is that the opposition also goes back a very long time, and that opposition has consistently used trigger words, manipulation, the play on fear and anxiety, to close off rational discussion, appropriate debates, and to lead to knee-jerk reactions to put things off the table and out of consideration. Now, I'm going to fast forward very quickly to the 1940s and just fill in a little bit. The campaign was derailed because of these kinds of tactics. It built up again slowly during the New Deal after a hiatus. President Franklin Roosevelt, that other Roosevelt, was wary at first, afraid of this opposition, afraid that it would scuttle the Social Security program, which was too important to allow to go down. So he waited his time. But once Social Security was effectively secured, passed in 1935, and it began to be implemented in its administrative dimensions, he and others in the administration began to push forward. The Social Security Board in 1944 called for universal national health insurance as part of the Social Security system. When President Roosevelt passed and Harry Truman, his vice president, picked up the baton, he ran with it very quickly and proved to be the first sitting president to really enthusiastically and consistently support single-payer health insurance. Truman was defeated, but by the 1950s, some very clever people in the Social Security Administration and elsewhere realized that there was a convergence of forces supporting a special version of single-payer, not across the age spectrum, but aimed at those 65 and older who had greatest medical need, who were retired, wouldn't be covered by the system that developed in the interim, that is employer-based health insurance. The Medicare strategy was hatched. Single payer for those over 65, which would have a tremendous amount of political support. But it too was resisted by these same forces, as we can see in the next slide. And the old tactics, socialistic, etc., all those labels were there, but with a new one. Now we're supposed to be beware of the British experience. Now begins the attempt to look at other countries in a distorted and misrepresented way to say, you don't want to go there. But this time, the supporters of single payer had something else going for them. Next slide, please. They had a dramatic, very vivacious young president who was not hesitant to rally the troops, who was not hesitant to work in alliance with other major political forces. My third and last take-home message, that we should never hesitate to form broad political alliances or to appeal to the grassroots, to connect the campaign for universal health insurance with our fundamental values as a nation. When we don't do that, in fact, this is what we're left with. Last slide, please. This crazy quilt system, it's a bit dated, it should say 50 million or close to it now, of the uninsured, where we worry about patchwork and stitching of the existing system and refuse to see or fail to see the big picture. And what we're left with is a very tattered and very crazy quilt. If we focus on stitching and patching up a failed system, don't see the obvious of a need for a dramatically new single-payer system, Medicare for all, across the age spectrum, that system will fail even more disastrously in the future than it has already. We miss the big picture, and in effect, we will simply restitch the lap robes on those titanic deck chairs as the ship goes down to the bottom of the ocean. Thank you.